Hello, yes, is this the medical registrar? Oh, great. Hi, my name is Sarah. I'm one of the junior doctors. I've got a patient who's not doing well. Would you like the details of the patient? Okay, fine. So the patient's name is Emma Smith. She was admitted, let me just check again. Oh, she was admitted on the 5th of February. And I can give you a list of her oh, you don't want to know the medications. Okay. The problem is that she's desaturating. Yeah. Saturation, the saturation was 83%. Oh, I haven't actually seen her yet, so I've not examined, but the nurse told me she was breathless. Do you have any advice? I hoped that looked awkward and uncomfortable because that was the point. Hi everyone and welcome back to the channel. So in this video we're going to talk about and break down a great framework that you can use to hand over. I'm then going to give you some specific tips that you can use while you're handing over and really the things to keep in mind. And finally I'm just going to run through an example with you of a typical handover using the framework that we'll have covered. So let's get started. So before we start, what is a handover? A handover is an exchange of information about a patient from one healthcare professional to another, and that happens when we're relaying over care or responsibility of the patient. So scenarios could be if you're on call at a hospital and so your colleague hands over a patient to you or things to follow up. It could be if you're calling your senior because you need help about a patient, that's also a handover. It could be a nurse calling a doctor because she's concerned about a patient. So it's a crucial part of the patient's pathway and healthcare. The reason I'm making a video about this is because handovers are a core skill. And the reason it's a core skill is because A, it's incredibly important for patient safety, as we'll talk about later. And it's something that you will be using throughout your career. Anything that is core, you want to practice and perfect as much as possible because you'll be using it for a long, long time. So handover is really a skill that you want to invest your energy in because it really matters. With all our patients, we want to maintain as much continuity of care as possible. Now, naturally, the system that is in place can hinder it because it's impossible for the same doctor to look after the same patient forever. You know, there's going to be night shifts, there's going to be weekends, there's going to be a doctor moving on to a different ward, and all that causes lapses in the continuity of care. And that's why handover is so important, because if you do it properly, it ensures that the colleague that you're handing over to gets all the necessary information about this patient in a structured, organized way so that they do what's necessary and don't miss out important information. Human error is inevitable, and that is in all fields of life. It's not just medicine. And what we want is to try and minimize that as much as possible. Now, there is a standardized framework that's been created for handing over, and it's called ISBAR. That stands for Introduction, Situation, Background, Assessment, and Recommendation. Essentially, it's a standardized approach that's been endorsed by the World Health Organization. Fun fact, ISBAR is actually based on SBAR, which is a system developed by the US Navy in order to ensure clear, precise communication between nuclear submarines. The key theme that you'll see here again and again and in other videos is about structure and organization. In all these core skills that we talk about, so the A to E assessment and the ISBAR method for handover, these are great tools and systems to help you have a structured, organized approach. In medicine, there's so many things that you need to know about, and there's so many things that can go wrong. And so it really helps to have a system to fall back on if you've got a sick patient in front of you. Instead of losing track of all the things that you need to think of, you follow that system. You follow your A, B, C, D, E, with the airway as the most important. You know that if you've gone through that system, you've covered the most important stuff. And it's the same thing for a handover. If you go through the structured approach of ISBAR, you will have covered the most important things. So let's talk about ISBAR. I is the introduction. That's pretty straightforward. Whether you're in person or if you're calling somebody, always check who the person is. So are you the medical registrar on call or whatever? Most of the time they will introduce themselves. So when you call on the phone, they'll reply saying MedReg on call, and you can start with your introduction straight away. It's important for the person that you're calling to know who you are, you know, whether that be a nurse or the consultant or a junior doctor. It just helps situate things. You then identify the patient that you're calling about. Ideally, at this point, you can mention where the patient is as well in the hospital. So now we get to situation. In situation, you're going to be presenting the thing that you're most worried about for this patient. So if you've got a patient who's got multiple comorbidities, they've got a very complex case, but you're worried because they're desaturating, you're not going to explain the whole thing and then finish with the desaturation. Whatever question or concern that you have, you list it in the situation section. Next, we have background, and that's basically the story of the patient. So you want to give a little bit of background of when and why they were admitted, and if there's any relevant past medical history. Note I say relevant. So again, see, this is a summary, so you don't want to list all the past medical history, just the relevant information that has to do with the problem you're concerned with. The next bit in the framework is assessment. So essentially that's you relating the assessment that you've done. In this section, you talk about the observations of the patient, the examination that you did. Again, you want to talk about the key positives and key negatives. You're not going to talk about the whole thing because it could take a while, especially if you've done a detailed examination. But you mentioned the relevant positives and negatives. So if the whole story is about, I don't know, foot injury, you don't necessarily have to mention that his abdomen was soft and non-tender and that he had normal breath sounds. Keep it relevant to the problem at hand. And finally, you get to recommendation. So in the recommendation section, you're clearly stating what you want from that person. Whether that be advice, whether you want an actual clinical review, so for the person to come and see the patient, or whatever else you may need, that is when you state it. I would add a step in here. So in the recommendation section, I would first say what I've done, whether I've started IV fluids or I've treated the patient in one way or another, and then I would tell the person what I need. And finally, you end by asking them if there's anything else that you should be doing. Now, you might have done a beautiful ISBAR framework and presented everything, and you sort of trail off in the end, you don't really know what to say. And that's the bit that can be problematic for a lot of people. So I think before you hand over, you need to have it clear in your head what you want from this conversation. And sometimes you may not necessarily know what the appropriate course of action is, and that's okay, but make sure that you communicate that. So you can repeat your worry and ask them for advice. You know, you can say, I'm worried about this patient because they're desaturating. I'm not sure what else I could do. Can you give me advice? Or can you come and see this patient? And that's absolutely fine, as long as you clearly communicate a need. Another thing you can say is, I'm going to start these investigations and this treatment. Do you agree with my plan? You will see all good handovers follow this general structure. And missing out any of these steps is going to make for a bad quality handover, because if you miss out the introductions, chances are you're speaking to the wrong person, or they don't know who you are, they don't know where the patient is, so that's already a bad start. If you don't talk about the situation and you start by talking about the background of the patient and the assessment that you've done, that is a beautiful, detailed assessment, but you've not actually talked about your specific concern, which could be that the patient's got a GCS of 8, then you've missed out a key bit of information. And again, if you miss the assessment bit, then the person you're handing over knows about the patient, knows the problem, but they don't know the present state that the patient is in. You've not given them a clear idea of the gravity of the situation. And finally, recommendation, which I think is the part that is missed most often, which is a clear call for action. I have done X, Y, and Z. I need you to do this for me. And so as you can see, this is a good framework because it really contains the key bits of information that you need to relate in a handover. So now we get to a couple of tips that I think are really important to help you do a good handover. And number one, I would say, is preparation. Now, especially if you're starting off, especially if you're a junior doctor, you're probably going to be bad at handovers, and that's normal. It's not an innate skill that we're born with. It's just like communication in day-to-day life. It takes practice to do it properly. And so instead of wallowing in self-pity and thinking that you're bad at handover, we need to prepare. And the more you do it, the better you will become, and the less preparation you will need. But for now, before you speak to your medical registrar or any other colleague that you want to hand over, prepare and structure your thoughts. So you've got this patient in front of you, the nurse has just called you, you're concerned about them, you've done initial examination. Don't just call the medical registrar. Sit for a second. You organizing your thoughts and even writing it on a piece of paper may take a couple of minutes, but I think in the long run it's much more efficient because you're relaying the necessary key information that you might miss out if you're not prepared. So what I would do, especially in the beginning, would be to get a pen and paper and just write ISBAR on the side and fill in the section roughly of the things that I definitely don't want to miss to forget, whether that be an important blood result or the observations of the patient or the specific thing that I need from the person I'm handing over to. And that way, when you're calling the medical registrar that is slightly intimidating, you're not going to forget the whole story and you'll have the key bits of information. So make sure you prepare and structure your answer in a framework. Doesn't have to be this one, but this is a pretty good one. Number two is to keep it brief. Now, I know this is really difficult because when we're starting off, everything may seem important and it's difficult to pinpoint the key positives and key negatives that you need to mention. So this will come with time. It's something I mentioned just so we're aware of it, because it's quite important when you're speaking on the phone to somebody not to bombard them with too much information, because otherwise the key information gets lost. The place you can mostly start to do this is in the background. So when you're giving a short background of the patient, just think, how is any of this relevant to the patient? You know, if I think my patient has a DVT and he's recently had an operation, then that's a relevant piece of information. So just try to start filtering the information you want to give before you hand over. Try not to just dump a massive amount of information on your colleague. And that's why point one about structuring and preparing beforehand is really helpful, because it helps you filter out and just write down the key information you need. And finally, my third tip sort of highlights what we've talked about before in the framework. But I would say if you really want to focus on two things, it would be start with a thing that's concerning you and end with a thing that you need. I think if you can do that, you should be okay. The rest will come with practice. But trust me from experience, if you call a medical registrar and you start with a long, mushy background of the patient without going straight to the point, it's very irritating for them because they have a lot of work to do, and it doesn't help you or your patient because it's just going to delay care. So you want to catch their attention at the beginning so that they can actually filter and listen to all the information that you give them afterwards. If you don't start with that information, they might zone out for the first half, and when you say, oh, I think they might have sepsis, then they ask you questions about things you've already mentioned. And when you finish, don't just trail off, say specifically what you need. And if you don't know what you need, then that's okay. Just say, I'm not sure how to manage this patient anymore and I need some support. Hello, is this the MedReg? Yeah, hi, my name is Sarah. I'm one of the junior doctors on the ward. I'm calling you about a patient that I'm worried has sepsis. So this is John Smith. He's a 59-year-old gentleman. He was admitted following a fall with a hip fracture, currently awaiting for his operation. He's known for COPD, but otherwise fit and well, not on any other medication. I saw from the notes that the patient spiked a temperature last night, 38, but nothing was done about it. And this morning he's tachypneic, desaturating it to 83%, and he spiked again to 39. His cap refill time is about 4 and he's got cold peripheries. The patient was alert this morning, but he's now getting more drowsy and confused. So far we've started him on 4 litres of oxygen, so he's now saturating at 95%. We've taken bloods and blood cultures, started the antibiotics IV, and he's also got IV fluids running as well. I'm worried he's getting more drowsy and I'd like you to come and review him, please. Yeah, that's fine. In the meantime, is there anything you'd like me to do? Yeah, we're getting an ECG right now. I'll ask radiology for a portable chest x-ray and I'll do the ABG. Thanks very much. So there you have it. Those were some basics of how to do a proper handover. I hope this was useful to you and that you'll be able to keep practicing and getting better at them. If you have any tips or advice, I'd love to hear them in the comments down below. Don't forget to like and subscribe, and I will see you in the next video. Bye!